After months of internal and external pressure, the amendments to the international health regulations and the new pandemic agreement appear watered down. But original concerns remain unchanged. They were originally intended to transfer major decision-making power from ordinary people to the World Health Organization whenever their Director General personally decides there is a threat of a pandemic. The most recent drafts, still under revision, are less overt in their human rights abuses, but remain highly inequitable and designed to enrich WHO's corporate sponsors. Although these unfinished documents now transfer money more than power, WHO still claims they are urgent to avoid an increasing threat of pandemics. This is shown to be definitively false. While outbreak reporting increased with new diagnostic and reporting technologies, outbreaks are decreasing. The databases and studies on which the WHO, World Bank, and G20 based their claims support this observation. Formerly independent, most of WHO's work is now specified by its funders, dominated by private investors, pharma, and countries with heavy pharmaceutical industries. Under the new proposals, WHO will contract products from these same pharma companies. It will control the regulatory process and declare an emergency to ensure a market. Manufacturers, absolved from liability and underwritten by public money, will derive risk-free profit. Despite the obvious conflicts of interest, WHO is not accountable to any legal jurisdiction. The centralized, commodity-based responses pushed by WHO are also bad public health policy. Infectious disease threats vary wildly between countries and populations. Any response must be tailored to differences in risk and local priorities. WHO once championed decentralization and community participation. Its new pharma-oriented funders now require the opposite. Article 55 of the International Health Regulations requires 4 months to review amendments before a vote. Yet these documents are still being negotiated fewer than 6 weeks out, breaking the legal requirements contained within these same health regulations. This rush to vote without appropriate review makes it impossible for countries with limited resources to assess impacts on their healthcare and economies. The proposed budget of over $30 billion, nearly 10 times WHO's current annual funding, will also require diversion from far greater health threats, like malaria and tuberculosis. This ensures the very inequity that WHO claims it wants to address. The reflections of past colonialism should not go unnoticed. With false claims of urgency, no demonstrated evidence of benefit over cost, and obvious conflicts of interest, proceeding with a vote in late May is irrational and irresponsible. This agenda needs to be postponed and properly considered. The world deserves better.